We are going to bandage the toes by anchoring 3 times around the metatarsals. We will then extend the bandage out to the edge of the nail bed and work our way back to the web space in a 50% overlap pattern. When we come back to the web space, we will then anchor again 1 time around the metatarsal and then come back out to the edge of the nail bed for the next toe. We will repeat that on each toe. The pinky toe may or may not be bandaged depending on if there is edema there. Sometimes, if the edema is minimal enough, simply the compression of the shoe is enough to keep edema out of the toe and creates less bulk, which leads to compliance with the patient. When this is finished, we want to check the consistency of the bandage and do a small pull on each toe and make sure the bandage does not slip. We're going to make sure it's a spongy feel, that it's not so tight it's restricting movement, but that the bandage does not pull off each toe. Next, we will apply a stockinette. We are applying the stockinette all the way up to the knee. We want to make sure there are no wrinkles in the stockinette. We are going to use the Vero padding in any negative space areas on the limb. That means if we held up a straight edge or ruler on the limb, if we see open space on the person's limb, we want to pad that negative space as we want to create a continuous pressure gradient. We also want to pad any negative space areas in bends and folds on the joint spaces to make the bandage comfortable. The Vero padding just tears by hand, so we're just going to liberally put this in any negative space areas and tear it. It sticks to itself, so you really don't need any tape to hold that on. You can fold the stockinette back to make the toes exposed to allow the toes to breathe and make it compliant for the patient to wear. Next, we are going to apply the Vero foam. We start straight across the metatarsals and then begin rolling up the limb in a 50% overlap pattern with no specific tension other than enough to allow the foam to lay flat and to not gap or bulge. There are no open spaces and no gaps in the foam. We can secure that with a piece of tape for the time being, as we will be going over this with the short stretch bandages. Next, we apply the Vero Land Short Stretch Compression Bandage for lymphedema and venous compromise. Use the Land 6 or 8 centimeter width, depending on the length of your foot size. Here we want to roll this on the even specific tension using a figure 8 at the foot. Keep the bandage close to the limb and roll it on and smooth out the slack, so that we are creating a consistent tension on the bandage that we cannot create if we pull the bandage away from the limb and pull, because we cannot be consistent in how much we are pulling at every revolution. If we consistently hold it close to the body and roll it on and then smooth out the slack, we can ensure constant tension of the bandage application. As with the law of Laplace, If we have a gradual increasing radius and a consistent tension as we go up the limb, we're naturally going to create a gradient pressure, with more pressure distally and less pressure proximally, which will move fluid up. At this point, you can have the patient stand and apply a larger stockinette to the thigh area. Sometimes it's a good idea to have them tuck the stockinette in their underwear to hold it in place for you. I like to split the full leg into two parts, as sometimes the thigh part is more apt to slip, so that if it slips, we'll still have a nice lower extremity bandage intact and they won't remove the whole thing. If it's all one piece and it's not split in the knee, it's more likely that they'll remove the whole thing if the thigh part starts to slip. Now, I am just going to pad negative space areas behind the knee and at any areas where there's open space or across a joint line. Here it's on the lateral side of his left knee. This is really the only negative space area. Now I am going to do the same thing, secure over the padding with the Vero foam in a 50% overlap manner. We want to make this snug enough so there's no gaps or pulling. As we go across the joint line, we make sure they can bend their knee and we continue the foam all the way up as close as we can get to the inguinal crease, taking out any gaps and pulls. We secure again with another piece of tape. For oncology patients with lymph node compromise, we want to get as close to the inguinal crease as possible. For that patient, and not a sports medicine patient, we would add another small piece of foam closer up towards the groin. The bandage will naturally slip as the patient contracts muscle and walks and moves. As their fluid moves out, it will start to loosen and start to slip a little bit over a 48-hour period, so we want to start with it as high as possible. Now we are adding the short stretch compression land bandage again with the rolling and smoothing out the bandage for consistent tension and a figure-8 pattern. We ensure the tension stays even by keeping the roll close to the body and then secure with a piece of tape. You would go up as high as you need to for the individual patient's needs. This could be to the knee for venous insufficiency, all the way up to the inguinal area for oncology concerns or lymphedema of the whole leg. While the compression bandage is on, we want to encourage the patient to move as much as possible, giving two-way compression to the lymphatic vessels. That way, we will have external compression of the bandage and internal compression of the muscles, resulting in a nice two-way compression that will work even more to move fluid out. And if you have extra bandage left at the top, then you're going to loosely drape it back around because we don't want to cut the land short stretch bandage. You can secure it with clips or tape. So here we have used an 8, a 10, and a 12-centimeter bandage, gradually going up in width of the bandage as we go up the limb.